This sessions I am going to brief about health infrastructure in India. Nowadays we are facing a lot of health issues in India. We want to know what type of the health infrastructure is existing in India. In order to find out that one, I am going to do this presentation. Health infrastructure in India, mainly providers, we have a major providers, healthcare services providers are there. Government is playing a very important role in that one. Around 23,852 hospitals are there in India, and then apart from that, health equipment facilities providers also there, and then health professionals are there. These are the major stakeholders, they are providing health services in India. When you are looking to the health care system in India, there are different structures are there. Primary healthcare system, secondary healthcare system, and then and finally tertiary healthcare systems are there. When you are looking to the primary healthcare system and then secondary healthcare system, these two structures are highly supported by different healthcare centers. Healthcare centers in the sense primary healthcare centers, subcenters, and then community healthcare centers. These are the three important healthcare centers. They are supporting the healthcare system in India, especially in the rural areas. When you are moving to that, when you are looking into the primary healthcare system, this primary healthcare system is highly supported, as I told you earlier, highly supported by rural, especially in the rural area, highly supported by primary healthcare centers and then sub-centers. In the urban area, health post as well as the family welfare schemes, many family welfare schemes also supporting the healthcare system in the rural urban areas. Yes, then now we are moving in towards the primary healthcare centers functions. Primary healthcare centers are providing so many functions. They are improvising, supporting the health systems in rural area. Especially when you are looking into their services wise, they are providing health services to the mother as well the child health care, and then immunization facilities, and then they are taking care of that preventive, curative, primitive and family health care facilities. And then one of the norms in the primary healthcare centers is minimum 4 to maximum 6 beds should be available in the primary healthcare centers. And then come to the case of that organization part, in each primary healthcare centers, minimum one medical practitioner and then as well as few health workers should be there. And then apart from that, 14 paramedicals who have to be there in that primary healthcare centers. Then now we are moving towards the sub-centers. Sub-centers also more or less same with the primary healthcare centers. That apart from that, the major services are more or less equal with the primary healthcare centers. Apart from that, they are also controlling diarrhea and then certain communicable diseases in that rural area. They are targeting the village populations. They are trying to improve the health of village populations. And then subsectors mainly focusing, and then they are medical practitioners of the subsectors are one lady health workers will be there. That particular health worker is in charge of the 6 subsectors in that village area. Then apart from that, one auxiliary midwife will be there, and then few health workers will be there. So this is the nature of the subsectors. Move to the next one, community healthcare centers. Community healthcare centers little forward, little ahead with the primary healthcare centers and then subsectors. Community healthcare centers are operating in the district level, and then there in the community healthcare centers, 13 beds should be available. Apart from that, they are targeting or they are providing 4 major healthcare services. First healthcare services highly targeting maternal health issues. They are taking care of the mother and then child, and then they are 24/7 delivery free service, free delivery system is available. And then come to the case of the child, they are taking care of the newborn babies and then health issues, they are taking care of it. Move to the third one, family planning method. They are giving counseling to the couples as well as they are creating awareness about the contraceptive methods among the village community. And then certain other facilities, other services also they are providing. They are creating awareness among the school children. And then next they are blood donation camps and all they are also organizing. And then finally they are also taking care of that health facilities of village level as well as at that semi-urban areas. So, these are the three major pillars in the rural area. Moving to that, okay, we discussed about these three systems are centers. Apart from that, who is organizing, who is managing this particular health centers, and then how the health policies are framed, who is in charge of that. To answer that particular question, this is happening at the 3-tier level: central government, state government as well as the local government. Central government with the support of Ministry of Health and Family Welfare, and then Director of controlling the health aspects. So, these two departments are taking care of the healthcare services at the central level. State level, state health minister, deputy minister and deputy chairman also taking care of that health aspects in that state level. Come to the local level, at the district level, local in the sense at the district level, they are dividing into different departments, and then taluks wise, blocks wise, community health block wise, and then village level, they are dividing their health services with the support of the primary health center and sub-centers and the district community health centers. They are organizing so many health camps and free services. So, with that, I am concluding my session. Thank you.